So let's look at some environmental factors for a moment. Take a look at this picture. There are at least 5 things that I can see here. See if you can come up with some things. I'm going to tell you in just a moment what some of the risk factors might be, because we all go, many of us, not all, sorry, many of us go into people's homes, so we're eyes and ears, and we can maybe provide very good, useful information. So when I look at this, one of the first things I see, the living room rug, right? That a person can trip on that as they enter the space with the 2 couches. So carpet tape, if they don't want to remove that rug, throw rug, carpet tape can keep that down. Also, that space is narrow, right? You see that chair on the left? So psychological space, as you close into space and you have to walk through it, that can throw people off. The couch on the right is very low. For some people who have weaker lower extremities, that can create a problem standing, and they may wind up plopping because they can't get that nice, strong eccentric contraction to slowly lower their bodies down. Look in the back at the sliding door. It's a narrow space. There's a carpet there. Depending upon the time of day, there could be glare that comes in, that bounces off the wooden floor by the door, that makes it hard to see something like a shoe that might be right there. Those are just, right? There was more than 5 things that I shared there. So educating the person, and if they're willing to play along, making changes in that room can make a big difference. Look at this. This is a very common scenario. That coffee table is so close to the couch, and that's where the person sits. So I'll often recommend, can we pull or move the coffee table out to create more space for you to walk in and sit down? Some people are like, great. And some people go, no, the aesthetic is important to me. The symmetry is important to me. So we have to, of course, respect that. Share the information, right? That's in the job description. But try to help them understand the value and the importance of the benefit of making that change. Sometimes we can get the person to go along. Sometimes we can't. Additionally, the rug there could be an issue. So again, I would think about carpet tape. I see lots of bathrooms when I go into people's homes that just too much there, making it hard to move in the bathroom. Add a little water with a little bit or soapy water to the floor. That just sort of ups the level of risk. Lots of stuff to negotiate there. Stepping in and out of that tub with all the that shelving unit and things, the throw rug or the bath mat that's right by the tub as well. Doors that don't open because furniture blocks it. Really hard to get through. If you have a walker, wheelchair, no way. And the picture on the right, getting to the desk with the roll top there, really challenging. Many people, if the upper level has a lot of carpeting, will leave their shoes at the bottom of the stairs, as you see in this picture, and then go up. Guess what? They forget. Late at night, they come down, they don't realize the shoes there, slippers there. Obviously, it's a big risk factor. So let's talk a little bit now about vision. Lighting is key. Someone 60 and older needs 3-4 more times light than someone in their 20s. Right? So we have to make sure that the lighting in a person's home is adequate. And we have to think of it not if we're seeing them during the day, but what would their home environment be like at night? We have to take that into consideration. Contrast becomes more challenging as we get older. So is there enough contrast? So an example would be a simple thing, if somebody was having trouble pouring and they had coffee every morning and they kept over pouring because they had, let's say, a black mug with dark brown coffee. Oh, how about a white mug? So when you pour, there's good contrast. So looking at the home environment, making sure there's contrast appropriate for that person so they can do whatever they need to do. Glare, making sure that the windows, maybe there's shades and things that at certain times of the day will minimize the glare. And how many people are wearing glasses with old prescriptions, right? So that talking with the person and identifying, hey, when was the last time you saw your ophthalmologist or had your eyes checked? That's an important piece too. So let's look at this picture. lower lighting. You can see the shoes there on the right. But somebody in their 80s where, they need a lot more light, it may even appear darker to that person. And look at the difference with better lighting. You can clearly see the rugs. You can clearly see the shoes. Look at the stairs. This could be a combination of the issue low lighting in the room where the stairs are. It's also changes in depth perception, figure ground. It can be really hard for many people to see where one step ends and the next one begins. Now, this was done with the computer, adding the yellow, but they sell tape, all different colors with non-slip tops, so that as the foot goes over the tape, right, there'll be a little resistance there to minimize slippage, of course. But you can clearly see here where one step ends and the next one begins. So that can make a big difference in someone's ability to use their stairs safely. And also going up. That makes a big difference. The other thing for those who have handrails, are the handrails secure? Ideally on both sides. Not always possible, of course. But make sure they're sturdy and double check to see if the steps, the rise of each step, is the same. I'm sure we've all been on a staircase at some point where there's some variability in the height, and doesn't that throw off your motor planning as you're going up or down? So that becomes an important piece as well to consider. If you think contrast might be an issue, here's a simple assessment you could try. And I use this a lot. I'll have the person get a pitcher of water, clear glass if there's one in the home, and I'll say pour the water into the glass and stop at the brim. If they have trouble with their hand, I'll do the pouring and I'll just say to them, tell me when to stop. And this, if they have trouble seeing that water come to the top and telling you, okay, that's it, that's a possibility, right? Just a flag that they may have an issue with contrast. And of course, I would refer them to an eye doctor. Good example here of glare. In the kitchen space, you can see how it's coming into the living room space. Can you imagine if there was a pet in that blind spot, a slipper, something that could really become a risk factor? Just another example of glare in the back and also the rug in the front. As you're coming in, look how easily it would be to trip over that floor mat. Something else, we have to educate people that if they're in a dark room, stepping outside to a bright sunny day, when they open that door and step outside, they have to wait. Or the opposite, if they come from a bright, sunny outdoor space to a dark space, step inside, wait for a moment. Allow your eyes to adjust. Because if you move too quickly, you can really put yourself at a risk for a fall.